Hi, this is Heather with Good Health Physical Therapy. Today I'm going to talk a little bit about upper neck malalignment and some of the muscles you can use to help put your neck back into better alignment. So this is the skull, and then this is the first cervical vertebrae, or C1, and then this is the second cervical vertebrae, or C2. And so people can have malalignment or instability, either one, between the skull and C1, and that's known as CCI, or craniocervical instability, or people can have AAI, or atlantoaxial instability, between C1 and C2. And so if the C1 vertebrae is out of alignment because of either of those situations, it's helpful to put it back into alignment, and you can use some little muscles to help. So if C1, this first vertebrae, gets rotated or turned out of alignment, you'll notice if you feel in the front of your C1 that it's forward on one side. And we have another video that explains how to find that bone with your fingers. So the muscle that attaches is called the oblique capitis inferior, and it goes from this little bone, the little spine of C2, to the little side bone of C1, and it contracts just like a horse rein, and it'll pull your head back, just like a horse rein pulling on that side as it contracts. So if you use your eyes and look to the side you need to activate it on and turn your head gently that way, trying to contract in the back of your neck, you can get that muscle to help pull C1 back. Sometimes it's forward on both sides, so then you need to do the contraction on the other side to bring that back as well. So oblique capitis inferior is really helpful for correcting that alignment. And then sometimes C1 can get slid side to side, so it's feeling more prominent on one side or the other. So let's say your C1 is slid over to the left and the bone feels like it's poking out over here. We need to pull it back to the right. And there's another muscle called the oblique capitis superior that goes from the same little wing and it goes up to the skull. And if you tilt your head to the side, it lengthens. So now it's ready and primed. If it contracts and you don't let the head move, you hold your head still, it'll pull C1 back over. So you can get a nice correction of the side to side movement. And then you'll feel that the bones feel balanced on both sides of the neck. So those are some great muscles to activate and use to balance your C1 alignment. And you can be doing that throughout the day so that your headaches are under better control, and it actually starts to stabilize over time. It'll learn where it needs to be, and the muscles will learn to stay on their own. So check out our other videos on this topic to learn a little bit more.